Hello, good morning, good afternoon, and good evening once again. This is Dr. Dennis Latuno, and today we're going to be discussing about acute pancreatitis. What is acute pancreatitis? It is an inflammation of the pancreas, and this inflammation will cause swelling and eventual pain in your abdomen. And if you have pancreatitis, you may feel like you have stomach pain that goes to your back. Pancreas is an organ in your abdomen between the stomach and your spine. And if you lay your right hand across your stomach, and that's roughly the size of the pancreas or shape of pancreas behind it. Remember, your pancreas is involved in the digestion and regulation of blood sugar. It makes digestive enzymes and hormones such as insulin. It delivers the digestive enzymes to your small intestine through your pancreatic duct. And there are several types of pancreatitis, usually acute and chronic, but today we are going to be discussing about acute pancreatitis. What are the symptoms of acute pancreatitis? Number one is epigastric or upper abdominal pain, characterized as dull aching. It usually radiates to your back, and the pain usually gets worse after eating. And occasionally you'll have fever, your rapid pulse, nausea, vomiting, and tenderness in the abdomen when you touch it. Causes of acute pancreatitis. Number one is gallstones, meaning stones in your gallbladder. And number two is alcohol consumption. Number three is hypertriglyceridemia, meaning elevated triglycerides in your blood. And others are unknown or idiopathic. But other causes includes medication and certain medication like rifampin, carbamazepine, enalapril, hydrochlorothiazide, erythromycin can cause pancreatitis, and occasionally hypercalcemia, meaning elevated calcium in your blood, pancreatic cancer, abdominal surgery or injury, infection, obesity, and even after a procedure called ERCP to remove stones in your common bile duct. Risk factors includes family history, obesity, diabetes, cigarette smoking, and inflammation of the pancreas. Diagnosis, of course, aside from the presentation of acute pancreatitis, which is abdominal pain, we do a blood test, which includes lipase and amylase, but more specifically the lipase because it's more specific to the pancreas. Complete blood count, we're looking for infection, especially elevated WBC. And then complete metabolic panel, we're looking for abnormalities in your electrolytes, especially elevated calcium and elevated BO and creatinine. And also check for lipid panel, especially triglyceride level, make sure it's not elevated. And then we ordered CT of the abdomen or MRI of the abdomen. And usually it will show you inflammation of the pancreas, or in case of the MRI, what we call MRCP, will show you if there's stones also in the common bile duct. but of course CT of the abdomen, sometimes ultrasound also will show gallstones. Chest x-ray to make sure you don't have any signs of respiratory problem like fluid in the lungs or congestion. Treatment. We usually keep our patient NPO, meaning nothing per mouth, for a few days. And we usually give IV fluids. Usually we give D5 half normal or D5 normal or even lactated ringer solution to hydrate the patient. And number 3, we give pain medication, IV morphine or Dilaudid to control the pain, and of course something for nausea, vomiting. And then also antibiotics only if there's signs of infection or sepsis. And then once the lipase trend is trending downward or the pain is resolving, we start you on a diet. We usually start with a soft diet and then advance as regulated, either to regular or cardiac. And then if we found through MRI or MRCP that there's a stone in your common bile duct, we ask for gastroenterologist to do ERCP to remove the stones in the common bile duct. And of course, if you have gallstones, once you're recovered from the pancreatitis, the surgeon will recommend to remove your gallstone through laparoscopic cholecystectomy. And if alcohol is the cause of your pancreatitis, of course you need to stop drinking and you need to seriously join AA or stop drinking altogether. Otherwise, it'll come back and will cause chronic pancreatitis, which is even worse. It will lead to chronic pain, and it's usually non-reversible. Complications of acute pancreatitis involves number 1 is necrotizing pancreatitis, pseudocyst. Repeated pancreatitis can lead to chronic pancreatitis. Then the most severe would be septic shock, kidney failure, and breathing problem like ARDS, infection, malnutrition, diabetes, especially if your beta cells in the pancreas are damaged, and eventually repeated pancreatitis also can cause pancreatic cancer. And then recovery in lifestyle. Not all causes are preventable, but you can reduce the risk by moderating your alcohol consumption. You can reduce the risk of gallstone and other leading causes. And especially if your triglycerides are high, you need to start taking medication to lower it down. And if you have coastal gallstones, then you need the surgery for that. You need laparoscopic cholecystectomy. Eat healthy diet and exercise regularly. Try to lose weight. All right. This is the end of this topic. Once again, this is Dr. Dennis Latuno. Thank you for subscribing. Continue to like and share my channel. And thank you once again for watching my video. And again, see you later and God bless.